Meanwhile, today, in analysis of all of this in the Wall Street Journal, Karl Rove highlighted some of what he is basically calling some fuzzy math in the Baucus bill, and we want to take a look at that with Indiana Congressman Mike Pence. He is the chairman of the Republican Conference, and Washington Congressman Jay Inslee, a Democrat on the House Energy and Commerce Committee. Gentlemen, thank you very much. Good to have both of you with us today. I know this is, in the very forefront of a lot of the action that's going on Capitol Hill today, so I want to get your thoughts on this, because as we take a closer look at this Baucus bill, let's pull up the first full screen that we have that talks a little bit about how the savings is found in this bill that's been talked so much about. And according to this editorial in the Wall Street Journal by Karl Rove, it says it assumes that employers who dump their employee coverage under the Baucus bill will then increase worker paychecks by the amount equal to what they spent on health care. Representative Inslee, let me go to you first on that. Do you think that's a logical assumption in terms of how the numbers work here, that if I'm an employer and my employees start to go to the government option, that I'm going to raise everyone's pay the same amount of what I paid for them in health care?
Well, I know this. I know one person I'm not going to take my health care reform advice from, and that's Karl Rove, who's been wrong on every single fiscal issue for 8 years. Listening to Karl Rove on fiscal issues is like
well, let me just ask you then, Representative. Let me ask you, because I'm sure that you.
The matter is,
no, let me ask you something. Let me ask you something. Have you read the entire Baucus bill?
No, I've read the 1,000-page House bill, and in our bill we have a deficit-neutral bill. Okay. And the reason that Mr. Rove is wrong again, like he has been for the last 8 years, is very simple, and that is that employees, if there is a reduction of their health care, are going to insist on making that up on wages. It's not like employees are sort of chumps that are going to be left out of this. We do have some negotiating authority, and what I know is that the Congressional Budget Office said this was a deficit-neutral bill. I'll take the CBO over Karl Rove any day.
Representative, I disagree. Employers, there's a 9.8% unemployment rate in this country right now. If employers' costs can be decreased by moving their employees to a public health care, I think that employees have very little leverage to say, oh, by the way, since you're not paying for my health care anymore, I'm not coming to work tomorrow unless you give me the amount of money that was given up because I opted for the public health care plan.
I'm sorry, I was waiting for Mr. Pence. If you'd like me to answer that.
Yes, I would.
Yeah, thank you. What the Congressional Budget Office, which is a nonpartisan, it's not Democrats, not Republicans, and they looked at this issue. They've got people who've been doing this for years, and they scored this bill, and they said it was deficit neutral, making assumptions as best anyone can about what will happen. And what they found is that first off, there will be a very, very small number of employers who, in fact, that would drop coverage. And for those who would, in fact, the marketplace will work, which is that employees negotiating for higher wages and employers kind of negotiate for lower, and the marketplace will work. And the final conclusion will be, this will be a deficit-neutral bill. Now, Karl Rove is the guy who gave us the largest deficits in the history of the solar system during the 8 years of the Bush administration. So thank you very much. We will not be taking our advice from Mr. Rove, who led to these huge deficits. We intend to do something about the health care costs. The Republicans don't want to do anything about health care costs. I got small businesses coming to me and say, Jay, I got 20–30% inflation rate. You got to do something about it. We're going to do something about it.
And I'd love to know if those same employers are going to kick in the extra amount to make up the health care deficit for those employees once they move them over. I beg to differ. But
well,
Representative,
that's what makes America great.
Indeed, it is. You're absolutely right. And I thank you very much for coming here today. We're going to ask Congressman Pence to hang on to after the break because we got into a lengthy discussion there, and we want to hear his side of this as soon as we come back. Thank you, gentlemen. Plan. And I've been speaking with Representative Inslee about this, and now we want to bring in Indiana Congressman Mike Pence, who's the chairman of the Republican Conference. Good to have you with us today. You know, and I think it's very helpful, actually, to look at hello there, to look at just this one aspect, because a lot of these numbers are very big to all of us, and it's hard to get through them. But when you look at this one aspect, and I want to point out that in the CBO scoring of the Baucus bill, it claims that this aspect that we're discussing is going to save $83 billion, and that $83 billion is going to come from employers whose people say, you know what, I want the public option. And then those employers decide to give their employee an increased salary because they're not paying for their health care anymore. And that becomes taxable income. And voila, you've got $83 billion in the government's pocket. What do you think about that, Congressman Pence? Is that logical to you?
No, it's not logical at all, Martha, and it's not really, it's not really credible. And let me say, I love debating Jay. He's a sharp guy, and I trust he's still with us. But, Jay said that Karl Rove in the last administration had the largest deficits in history. Well, that was until the Democrats passed their budget this year that'll double the national debt in 5 years and triple it in 10. And as someone who battled against Republican big spenders back under the last administration, I identify with the past, but I'm more concerned about the future. Item 2 is the House Democrat bill actually did score at a $200 billion deficit. What Jay is referring to and you're referring to is the bill, if you want to call it that. There's really not a bill in the Senate. The CBO scored this concept that they're developing in the back rooms in the Senate as being deficit neutral. But I will concur that the point that you make just is kind of illogical. I mean, if employers drop employees from health care coverage and send them to a government-run plan of some form, they have to pay a minimum amount under a wide variety of versions of these bills to the government, and it's rather inconceivable that they would also increase people's payroll for what for what they used to pay in health care. But again, the Baucus bill assumes that those employees will be paying higher taxes to the tune of $83 billion by virtue of the fact of their salaries going up. There's also a lot of other fuzzy math here, Martha. I mean, Karl Rove, I think, rightly points out, as Mr. Elmendorf pointed out, that this Democrat bill, if you want to call it that, uses 10 years of tax increases and benefit cuts to pay for just a couple of years of health care benefits. Right. And so, there's a lot of, I really think all of these numbers are going to cause the American people to take a half step back and demand that Congress scrap these concepts in the House and Senate and start over with something that'll focus on lowering the cost of health insurance and lowering the cost of health care.
And let me bring up one other specific here and get your reaction to it. And I'd like to get Representative Inslee back into the discussion as well. And the second one, if we could put it up on the screen, is that receipts from the 40% excise tax in the Baucus bill that would be put on those Cadillac insurance policies, they claim that the receipts they're going to get from those really, expensive health insurance policies, because they're going to tax those, is going to grow by 10 to 15% a year after 2019. Now, I recognize we're looking far out into the future here, but doesn't it make sense, Representative Inslee, that if those kinds of health insurance plans, if you're lucky enough to have this really great health insurance plan, like I might point out, members of Congress have a very nice health insurance plan, that would be taxed at 40%. So wouldn't you think there would be a disincentive on the part of employers to continue to even offer those kind of good comprehensive plans, Representative Inslee?
Well, look, the best we can do is look at what the independent analysts have looked at, and none of us have a total crystal ball on the nickels and dimes involved in this. And I can tell you that we think in the House version that we have passed out of committee is a preferable way to finance this. And there are costs associated with this. Americans know we don't get something for nothing. We have proposed an alternative way, instead of taxing those what might be called Cadillac plans, but to restore what the tax rates were before Karl Rove and George Bush came to the White House on the people who earn, $500,000 or 250 up, on that top 1% of folks, just to go back to the pre-Bush era rates. We think that's a preferable way to do it. It is more predictable, frankly, so we don't have to have this argument. But I want to point out one thing, too, that is really important. I hope Mike and I both agree with.
All right, quickly,
we do have to restrain the rate. We do have to restrain the rate of our medical inflation. And there is a provision we agreed to last week in the House bill that will reorient the way that we reimburse doctors so that we get value rather than volume. Mm-hmm. And this is something I think is very important that I hope we can find some consensus on. We can have a new way of essentially reimbursing our hospitals and doctors so that they give us high-quality value versus volume. This is the way to ultimately reduce medical inflation. I think we're going to succeed on this. All
right. Well, you gentlemen have your work cut out for you, and I appreciate both of you being with us today, Representative Inslee and Representative Mike Pence. Thank you so much, gentlemen.